much will you pay for health care in retirement? Or how much of your retirement assets, retirement savings, and retirement income are going to go to your health care expenses in retirement? That's what I want to talk about today on the channel. And here's the reason why. 61% of workers today have delayed retirement because of the concern of health care costs or the inability to pay for their health care needs. And another 60% of workers are concerned that health care costs and the rising nature, a 4.4% inflation increase on health care every year, will impact their retirement income and their retirement savings as they go into retirement. So we need to know how much healthcare is going to cost us in retirement and what we can do today to start planning for those healthcare costs. Because here's the statistic. A healthy 65-year-old couple today is anticipated to pay about $387,000 in total healthcare cost throughout their retirement. $387,000. Now that includes Medicare premiums, any supplemental insurance, co-pays, deductibles, drug costs, and non-covered medical expenses. Now, I know what most of you are thinking, Drew, that's got to be long-term care, assisted living, retirement homes, things like that. These figures do not include long-term care. I recently wrote a book with my dad called Have You Ever Been Bitten by an Elephant? It talks about the 6 mistakes that retirees make. There's actually a link in the description below. But one of the mistakes that we outlined is not having a long-term care plan. Now, in this video, we're going to talk about healthcare costs and long-term care. But you need to have a plan for both your healthcare and your long-term care. Now, here's another sobering statistic for you. If you're younger, if you're in your 40s, it's anticipated that a healthy 40-year-old couple will spend about $455,000 in healthcare costs throughout their retirement. Now, what's sobering is that's in today's dollars. So put about a 3% inflation rate on that, go 10, 20, 30 years from now, and really get an eye-opening experience on what $450,000 truly looks like. A healthy 50-year-old couple is anticipated to pay $405,000 in healthcare costs throughout their retirement in today's dollars. Again, take a 3% inflation rate, look at that 10, 20, 30 years from now, and you might want to throw up. So we got to look at this and say, okay, how much in healthcare costs are we going to pay and what can we do to help mitigate healthcare costs? Now, the study that I got all this information from, they said this, and it was really kind of interesting. If you are healthy, you're expected to actually pay more in healthcare costs throughout your retirement. You're like, wait, what? Healthy? Yeah, healthy. Because you're going to live longer. You're going to do the things that you need to do to stay healthy and to live longer. Thus, you're going to pay more for your healthcare in retirement. The study actually said if you want to pay less in healthcare cost in retirement, you need to be unhealthy because you'll die early. And if you die early, you won't pay those healthcare costs. But we don't want to do that. Remember, on this channel, Your Financial EKG, we want to help you get to retirement, through retirement, and protect your ability to stay in retirement, which is why we're talking about healthcare in retirement today. Now, in today's dollars, so right now, a 70-year-old couple in the year 2024 is anticipated to pay about $16,000 in annual health care costs. That same couple at age 75, so 5 years later, is anticipated to pay about $21,000 in annual health care costs. At age 80 in the year 2034, anticipated to pay about $27,000 in health care costs. And at 85, so 15 years from 70, $34,000 is our anticipated annual health care cost. And remember, if you forgot, this does not include long-term care. Remember, one of the biggest mistakes you can do in retirement, what we just talked about when I wrote my book with my dad, is that you do not have a plan for long-term care. You need a plan. So let's talk about 3 things that you can do to help mitigate and lower your healthcare costs today. Well, number 1 is maintain a healthy lifestyle. Now, we just mentioned that those who are healthy and live longer pay more in healthcare costs. But wouldn't you rather be there, maintaining a healthy lifestyle, maybe not having to take the medication, maybe not having to get the surgery or go through the treatment, if you can maintain a healthy lifestyle? Now, I'm not a dietitian. I'm not a superior expert when it comes to exercise or in healthy eating. I just want you to look at yourself and say, what can I do to continue to maintain a healthy lifestyle so that we can keep our health care costs low? Now, moving on from that, because I don't want to get into that too much. Now, the second thing that you can do to help lower your retirement costs for health care is have a plan for your health care. And I know that sounds really simple, but what if you're thinking about retiring at 50 and your health insurance is offered through your job? Well, do you have a plan to pay for your health care from age 50 to 65 until you get on Medicare? All those dollars that are going to go to health insurance, what if you stayed working and you repurposed those dollars for another 5 years, 10 years, 15 years, and put that towards an HSA or a bucket of money that you've invested and you said, okay, this bucket of money one day will be for my long-term care. Now, I'm not telling you to get long-term care insurance. I'm just telling you have a plan for your health care. Understand that the decisions that you make the day you retire, when you claim your Social Security, how much retirement income you're taking out of your investments, your taxes, everything affects your health care cost. And one of the things that I look at for my clients is saying, okay, you're 70, here's what we anticipate that you'll pay in healthcare. Do we have the funds to do that? And if you want me to put together a financial EKG for you, there's actually a link in the comments. It's called the Roadmap to Retirement. Download that free booklet. There's a little box that says, do you want to meet with Drew? Select yes, and we can go through your retirement plan to make sure that you are prepared for the rising cost of healthcare in retirement, okay? Now listen, thank you so much for watching. I hope this was enlightening. I hope this opened up some thought patterns that maybe you didn't have before that will help you getting to retirement, getting through retirement, and protect your ability to stay in retirement. So again, thank you so much for watching. Have a wonderful day. God bless. Bye-bye.